Hey guys, and welcome back to the You Know the Drill podcast, the podcast hosted by me, Faris, and my mate Robbie, two fourth-year dental students producing content for all your dental needs. Whether you're a dental student or applicant, if you want to learn more about the reality of dentistry, this is the podcast for you. If you want to keep up to date with all our episodes, make sure you follow us on Spotify on @YouKnowTheDrill podcast, and check out our new YouTube channel and Instagram to keep up with all the updates. Thank you.
So today we are joined by Dr. Denzel. He is the clinical director of Assistant, a company that aims to assist dentists with the use of artificial intelligence. We are excited to find out more about this unique branch of dentistry from Dr. Denzel today. And we hope you can give us an awesome insight into artificial intelligence technology in dentistry. So without further ado, welcome onto the podcast, Dr. Denzel.
Hey Rob, hey Faris, thank you so much for having me on. Huge fan of your podcast, and it's a pleasure to be here.
Thank you. Cheers. And yeah, we're very excited. I think, AI is one of those topics that is quite hot. Like a lot of people are talking about it. I think being credit Elon Musk for that. But within dentistry, I think it's something that's not really touched upon. But just before we kind of dive into that, can you give us just a little introduction about yourself, just for our listeners?
Sure, okay. My name's Dr. Denzel. I'm a dentist living and working in London. I graduated in 2019 from Valencia, Spain. As you already said, I'm the clinical director of Assistant. It's based in Manchester University. It's kind of a spin out from the Manchester Dental School. Aside from that, I recently this year won Best Young Dentist in London. And I'm also, thank you. And also just the honorary global ambassador for Slow Dentistry, which is like a network of dentists throughout the world, just kind of aiming to better patient care.
Yeah, I think I heard about that from, wasn't it like Dr. Miguel Stanley, I think it is?
Yeah.
He's one of the, yeah. Nice. Awesome. Amazing. Very interesting. I feel like we need another episode to talk about your like other experiences. But just for today, could you give us a little bit of a definition of what AI actually is?
Okay. So I think like most people, AI is still quite relatively new. So a lot of people don't know too much about it. I think if you hear the words artificial intelligence, you kind of probably have images of like cyber soldiers or killer robots from the movies, right? However, everything is still in its infancy of any the technology to date. So it's going to be a long time before we have any of that, not in our lifetime anyway. But a little bit of a background of what artificial intelligence really is. It started in the year 97 when IBM had a product called Deep Blue. And it was basically this machine, and they trialed it by having that and world champion chess player. Play one another. And as you know, as it beat the chess player, that's when a lot of people were like, "Oh my god, what is this thing? How does it work? What's the future of it?" Right? So with it, it's just kind of like analyzing large sets of information and finding patterns in them. And as it does so, it learns to assess different situations and make informed decisions and predict outcomes. So it's kind of like mimicking human intelligence, but all done by machine learning.
Wow, that's amazing. Awesome. So if robots take over in the future, we can blame IBM then. We know where it started now.
Exactly. I'm just happy you said Deep Blue, because when you said that, I was like, oh, chess. I remember it was like, it wasn't Karpov, it was some other like very famous like Russian chess player. Oh, that's awesome. Yeah, that's very interesting. I think, as you said, when I think of AI, I instantly kind of think, I don't know, it's just kind
robots.
It's a scary word. Yeah, it's robots. It's just kind of a scary word. It's like we're just trying to mimic human behavior. And I kind of think, like, why exactly do we want to do that with dentistry? Like, we have enough patients. Like, what is the actual benefit of doing so?
Definitely. As in, like what the whole purpose of us bringing AI into dentistry, like they do in every kind of field, is not to replace the dentist or any humans whatsoever, but it's just to make the task and what we do more consistent, more reliable, and just an easier kind of workflow.
Okay, interesting. And so, are there any like procedures that you could use AI for in dentistry?
Definitely. Already, I think there has been an implementation of AI in the workflow that we're already trying to do. As in, I'm not too sure if you guys are using scanners in dental school yet. We're learning the technology, but with that
Once.
as well, and that's still good. That's still getting you involved. Have you guys done
Yeah,
like the
yeah.
haptic suite yet, where you do like the
Yeah.
kind of things with the AI and things? So
Mhm.
slowly, we're trying to get more technology out there for dental students as well. As in ourselves at Manchester Dental School, we're trying to aim to get our technology into all the different dental schools across the UK.
Mm.
Maybe not now, but probably next year. Hopefully, you guys will be using us to kind of help you with your diagnosis stage and formulating treatment plans as well.
Wow.
Yeah, I think my only exposure to AI so far within dentistry that I'm aware of is like note-taking softwares. So
Yes.
there's a couple that we've seen that have risen up this year
Mm,
that kind of look into this aspect of, okay, well, there should be a relatively standard way of diagnosing a patient. How can we standardize that using notes? And like kind of, I think it's really interesting because it allows us to kind of track how dentists, use their problem solving skills to find solutions. So I guess it will be, good for in the future for like litigation and preventing that. But
mm.
yeah, that's one of the ways I've thought like AI looks quite interesting currently.
For sure, as in there's Heroku, My Fly Notes. There's quite a few different companies that are doing what you just
Yeah.
said, and I think the more probably next year or so, we'll probably start to see it get more involved with dental schools and dentistry on the whole.
Yeah.
Hmm.
And so just a kind of a personal question about your experience with AI technology in dentistry. What kind of made you interested in the first place to, start learning more about the use of AI technology and be involved in developing new things?
I think for me, the journey of AI began in dental school. When I was in clinics, I had a clinical session and I had a patient where I was a little bit unsure of the right treatment plan because it was quite complex. So I asked the tutor to look at the patient, look at the radiographs, and help me with the treatment plan. And they said something, and I was like, oh, cool, I'll do that. And the next day, we had a different clinical tutor come around, and he was like, okay, what are you doing? What's the treatment plan? Show me. And he's like, no, 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 that doesn't mean that. It means this. Let's do something else. And
Mm.
then I realized that we have different dentists of different kind of experience. I'd say one was quite a lot older, one was younger, but even so, both of them had different interpretations of what the X-ray meant and what treatment plans we should have, right? And that kind of inconsistency shouldn't be put around when we're playing with
Mm.
patients. We should have a standard set of rules for what the diagnosis is and what their treatment plans are. So with that, I was like, okay, what can I do? And in medicine, we've already had the technology of having an AI, an algorithm, automatically detect abnormalities in radiographs for them when it comes to lungs, when it comes to brains. And I was like, okay, hold on. As dentists, we probably take more radiographs than anyone in the medical profession. Why do we not
Mm,
have this system in place? So I actually started in dental school to kind of build a database of as many x-rays as I can and then try and get some expert dentists who've been in the field long enough, looked at enough radiographs to start expertly annotating the radiograph. And then from there, I kind of did build up my own little algorithm that can automatically detect what a class one caries is, or what calculus is, or how much bone loss there is, and started really my journey from there.
wow, that is so like impressive. That is so crazy. Like you've really thought outside the box there. And I think that like having that level of like initiative while still being a student in dental school and also having, the knowledge to kind of create an algorithm and kind of bring this idea to fruition and get AI technology to tell you what kind of class of caries you have. That is really, really impressive.
Thank
Mm.
you.
Definitely.
It's a long ride. It's not easy to to do something like this, and very boring.
Yeah.
I think in dental school when I was doing it, my teachers said, "Yeah, no one is going to use this." A lot of students were like, "Yeah, this guy's wasting his time," because at the end of the day, no one really wants to admit, like, I don't need any help reading an X-ray. I'm a qualified dentist. I know what's there, and it's not me
Mm.
saying no one can read a radiograph. It's when you're seeing 20 patients a day, looking at 40 different radiographs, are you still having the same consistency and not having your own kind of judgment, like kind of influence for
Yeah.
decisions on patient to patient? It's having that consistent, accurate, reliable kind of diagnosis the whole way throughout. And now we see companies all over the world, and there's about 10 different companies now doing what I set out to do. So it's kind of great to see that. And I think, more and more in future, it's not going to be just with diagnosing radiographs. It's probably going to be a lot more in the dental clinic to do with AI.
Wow, interesting. Okay,
Very,
so
very. Yeah.
yeah, now a bit about the pros and cons of using AI technology in dentistry. Starting off with the pros, we'll start on that note. What are some of the pros of using AI technology in dentistry?
Right. So some of the pros are it's definitely going to be more time saving, right? So I think we spoke about before with using a system such as Heroku that has kind of automated notes in place, right? From there, you can actually time save because you don't have to spend all that time writing it out for
Mm.
each patient. It's kind of already put there for you in a kind of a flowing system, right? The time saving was also one. There's also other companies that have the patient's medical history there, and then they have any kind of medication or any other treatment plan there that correlates what medication they have to what treatment planning they have. So, for example, with any extractions, with any blood thinners, it automatically does that for you. So
Mm,
sometimes you know, on the off basis that you forget what kind of medication they're taking, or like you don't take that into account with their treatment planning, it's always there as a kind of a backup, as a safety net for you as well, right? When it comes to
yeah,
diagnosis, again, sometimes it's really hard to see early enamel interproximal caries between teeth or so on a radiograph. Having a system like this is a safety net because, say, for example, you see a patient, you miss that caries, they come back a year later, and they're like, hey, this tooth really hurts. You take an X-ray and you find out that the decay has gone into the pulp now and it's hit the nerve. Like, I came here last year, you didn't say anything. And then, they
Mm.
find out that the radiograph actually did show a little bit, right? And then they take it to GDC. What are you going to do then, right? So it's a safety net, um, as well as being time saving, as well as being like non-subjective. And when you show to patients that you have a system like this in place, it actually has them a bit more trusting to you as well. Because unfortunately, in the dental profession, the way that the NHS is set up in this UDA basis, and even before then, this fee per item, a lot of patients come into the dental clinic and they're not so trustworthy of what the dentist is telling them. And I'll be like, do I
Yeah.
really need this filling, or is he just trying to make a quick buck out of me, right? When you have a system in place that's non-subjective and that just highlights abnormalities in X-ray for you and the patient, they can
Mm.
start to see, hold on a second, he didn't even show that or highlight that area. Maybe
yeah.
there's something going on. Maybe I do need to uptake this treatment.
Mm.
That is
Interesting.
cool. Yeah, I
Yeah, I
think.
think this it's interesting because I think everyone in dentistry, even at dental school, you it's very quick to start identifying potential problems that are going to occur once you qualify. But you're kind of like, okay, it comes with experience. I think just before we go into disadvantages, one of the big advantages of AI is it kind of levels the playing ground. So first, it standardizes the type of treatment you're going to be trying to do in
Mm,
terms of the decisions that you're going to take, the planning that is going to be undertaken with the AI. But at the same time, I kind of feel like it allows you to have a basic level of experience, even if you're a new dentist. It allows you to have a good starting point where you're kind of learning from the AI as well. Because as you said, it's not based on for us it would be like foundation level dentistry. It's going to be based on experts that have kind of curated this software and allowed the beginning of something that's going to be a lot more advanced. So I think that's very, very interesting. But I know we've kind of talked about the amazing things. What do you think are some of the biggest drawbacks with AI at the moment?
So some of the drawbacks would have to be the patient database of what you're using to
Mm.
build the algorithm in the first place. Are you doing it from, for example, where are you getting your X-rays from? Are you getting it from a dental school clinic? Because you've got to realize that people who go to a dental school clinic, when I studied in Valencia, want the patients of of a good socioeconomic background. There are people who normally couldn't afford to have proper dental care, and sometimes it meant that those are the patients walking through the door were dentally unfit. They had loads of caries on them. And when you're training the algorithm, does it automatically kind of have that and put that as the norm of a patient? So definitely having the patient database has to be accurate. If you're doing it with dentally fit patients, or you're just doing sports teams or something like that, it might then make the algorithm think that the average patient has little or no caries, right? So definitely where your sample size is coming from is very important as well. And secondly, a little bit of a drawback on that as well is you've got to realize that this does not in any way does do the diagnosis for you. It aids you with the diagnosis, but ultimately the diagnosis rests with you, the clinician, and you have to take responsibility for any treatment plan you put out there or what you're saying the diagnosis is. Because in any kind of platform, especially when you're doing kind of image analysis, you have to find a specific level of sensitivity. So for me, I've always had great trouble, like, having when we're talking about, example, early enamel interproximal caries, what is, like, cervical burnout or what is actual caries, right? So to find that level, sometimes I put it onto a level where it's going to pick up all the caries we have, but sometimes it might show something that's not caries, but that's the kind of the level of sensitivity you have. So as a clinician, you still need to make the judgment call. So that is some of the drawbacks as well. But I don't really look at it as a drawback because, one, that just shows that the machine is never going to replace you because you're always needed to be the person in charge to find out what diagnosis and what treatment plan you haven't have.
Yeah.
But some people are like, oh, I wish it could do this for me, but it's never going to get to a point where it does that.
Okay. All right. And with regards to, using this software or technology in day-to-day practice, how accessible is it? Yeah. How
As in
accessible
at
is
the
it?
moment, yeah, at the moment right now, as in this software in particular with Assistant at Manchester Dental School, it's readily available everywhere. You can just go online, download a desktop web application from it, have it in your surgery, your PC, and there's all these other amazing companies across the world that already have it accessible. Right now, though, it's just the implementation needed for dentists to really kind of sit down and be like, okay, you know what, I really think this can be helpful for me, and more people need to talk about AI, start to use it. It's kind of like using scanners instead of taking impressions, right? In dental school, I'm still sure that you guys are still taught how to take impressions. I see, like, people from 30 almost still doing it. It's like scanners are ultimately known to be better. As in, when I'm talking to labs and I say, hey guys, what do you guys want? Impression or digital? They was like, digital is always better, right? And although digital is readily available everywhere, not every dentist is using that, right? And why? Sometimes because of cost, sometimes they prefer what they learn in dental school. So we always have to have systems in place that slightly change. So, for example, one of the things I'm doing now is I'm talking to Health Education of England to implement something which I created called the GAP tool. So it's a system where, I'd send you 6 radiographs for you to diagnose by yourself. Then I send you six radiographs for you to diagnose with assistant. And then after, you'll see a tally of how many radiographs you diagnosed correctly and how many you didn't, how many with assistant you did, and how many you didn't. And always, we've had, clinical studies in the BDJ, ADEP studies that show that using assistant is always better at you being able to diagnose properly and more effectively. So when we introduce this to Health Education England, they have their foundation dentists take it at the start of the year, and then you
Yeah.
assess, okay, how good are you at judging X-rays, and then you take it midway through the year. Have you got better at the end? So it's a system in place to help you train you become more better as a clinician yourself.
Okay. Interesting. So, why should young dentists embrace the use of AI technology in dentistry, in your opinion?
But my opinion, is the future, as in, comes with this whole digital workflow coming from the old school ways of we're using wet film radiographs to, take a photo and put it under, the dark room, and being able to reveal it.
Yeah.
It's the future. It's, if you want to be able to be better at your workflow, get better results for your patients. So even if you want to be a clinical, a cosmetic dentist, sorry. So if you just want to do that, composite bonding and Invisalign and stuff like that, it's still really important to be able to have a system like this in place because, one, can only do cosmetic work on patients that are generally dentally fit. So if you run a system through them, see all X-rays, see that they're dentally fit, you feel more ethically safe. Like, great, I know I can do work on this patient, and it's going to be good because they're a healthy patient. They look after their teeth. They haven't got any abnormalities, and you can even take it after you've done all your work on them, just to ensure that they're all still staying generally fit. So it's a new trend, as in 100%. This AI stuff is the future. I don't think it's ever going to take over us as dentists. I think we're still a long way away from
Fingers crossed.
but I'm sure it's going to help us a lot.
Yeah, I like how it's kind of being framed in this. From what I've learned so far, it seems, because again, everyone kind of thinks. I think it's the same thing like with the Industrial Revolution. People saw, oh, these factories, oh, these robots. That's it. Like, humans are not useful anymore. But I think it's more of an assistance or generally like it's a virtual assistant, isn't it, assisting you in your treatment, your diagnosis, etc. I do think that the one thing that kind of like as a dental student, or even as a potential, hopefully when I've got a dentist, that I'm thinking about is this idea of the database. Is how does the software identify what's standardized when you have a variety of different cases in different backgrounds through every dentist, through every dental practice, even in very similar regions. That's the only thing where I'm thinking like, I don't know if that's a potential limitation, or if once enough it's kind of one of those things where at the start it's a problem, but once enough people adopt it, the database kind of grows like naturally, and as a result, if you have a larger sample size, that increases the probability of the software having greater accuracy. So that's just where my head's at, is with regards to how will it standardize things as time progresses, and whether or not there's going to be enough adoption at the start, like that initial,
uptake,
batch of initial uptake that will allow it to reach that goal. But yeah, it's interesting. I think this is, it really is something different in dentistry. It's not like obviously scanners are fantastic and everything, but AI is something a little bit more niche in the sense of it. Once it's unleashed, I think there's so many applications for it. It's not just, this is just for pros, this is just for this. It's within every specialty of dentistry where AI can kind of intercept. So yeah, very interesting.
Of course, definitely. As in, I always kind of look at it and think, why wouldn't you? This is something that's going to assist you, make you a better dentist, make you be able to provide a better patient journey and patient care. For me, it's always been a no-brainer, as in this is the way forward. I sort of think, I think when you talk about the factories and stuff, they're like manual labor jobs. Yes, you can have that replaced by AI, but when it comes to something like a dentist or in a medical professional, you always have to take responsibility of someone else's care, and no one is going to leave that up to a machine to decide. So it's different in that sense. So the only way I feel like it will be involved in the medical industry is purely for assisting.
Yeah. Okay.
Definitely.
And then just leading on to the final few questions now. So you kind of touched on some of these a bit earlier, but how can AI technology be further implemented in the dental profession going forwards in the future?
Going forwards in the future, I feel like it can probably be implemented in a few different ways. I think always kind of just helping the patient have an easier kind of workflow from coming into clinic. So for example, I think those consenting forms with my fly notes, having them really understand what their procedures are more understanding. So I think a lot of patients come into the dental clinic and they're not so familiar or aware of what their conditions are. I've explained to them so well. They're like, there's different companies like Chairside, my fly notes that can really send the patient back home with a lot more content and understanding, and maybe like visual aids or in any form that they want to digest it in, to be able to understand what is happening at the dentist. So their understanding and their informed consent for whatever treatment that they decide to do is a lot more valid as well. Aside from that, I just think there's going to be a lot more systems in place that are just going to make it easier for us, fewer clicks on the mouse to get to where we need to do, and just kind of more thorough screening of patients, better understanding of what treatment plans we should have. I feel like everything should become more standardized, doesn't it? I feel like us three, if we was to sit in a room and have a talk with a patient, look at them, treatment plan them, diagnose and treatment plan them, all of us three should have the same results, because there should be what is wrong with the patient. That should be a clear diagnosis, and then a treatment plan of what is best for the patient. That should become clear as well. In this day and age, if I go to 3 different dentists, I'm fairly certain I might get 2 different treatment plans. That shouldn't happen in the field of in dentistry. So I feel like AI will be something that will come into place that will really tackle that problem.
Perfect.
Yeah, and I think one thing I just want to ask you about is, how you've mentioned that you can utilize radiographs and have that kind of standardized with AI. Can you do the same with like clinical images? So let's make an assumption that I've taken some pictures of a patient's smile. Would an AI potentially be able to be like, okay, well, I see, the clinical crown height is XYZ. This is the recommended treatment, or is that something that isn't really possible?
No, I think a few companies in the US have tried to do that already. It's all about accuracy of how it helps, because I know there's some stuff that people can take at their homes and take a scan of their mouth, and they'll be able to kind of find out what's wrong with it. So it's all about kind of clinical evidence is a big one. I always kind of go by, okay, what is the clinical evidence of how accurate that is, how safe it is, and how it will improve the patient's kind of health in general. So these ideas of what you just said, there already are companies out there doing them, but being able to do so accurately, consistently, and safely is another question. But image analysis, that's already being done as far as I know.
Oh, amazing.
Yeah.
That's and I just kind of have one personal question. What part of AI do you find the most exciting? Like, is there one thing where you're like, this is the thing that, like, this is really cool?
I think probably in our everyday lives, as Tesla with these self-driving cars, like Alexa, all of Siri, all of these things. I think in our everyday lives is evolving more and more, not just in dentistry. I think dentistry is probably one of the industries where we're so far behind the
Yeah.
use of AI in our workflow, as in this radiology stuff in the medical field. It's already been doing and happening with lungs and brains and stuff. So I feel like we're a bit late to the party with it. But I'm just
Mm,
hoping that we're able to embrace it and have everyone on board and jump on with it.
nice.
Yeah.
I just feel bad for anyone that had this on loud and just had Alexa, Google, and everything, and just go off. So we made the podcast interactive. But yeah, excellent. Well, thank you very, 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 very much for your time. We always have one final question we like to ask our guests, which is, what is one tip you would give to people who are thinking of applying to dentistry at the moment?
Wow. Okay. One tip I would have for them when they're applying, right? I think when I was applying for dental school, one of the things I used to do is definitely my work experience. I did it in a variety of different fields. I did it in the army. I did it in orthodontics, different specialities. So if you're looking to apply for dental schools, don't just go to your general dentist and have work experience there. Dentistry is kind of a multidisciplinary career. You can do so many things in it. Like you can even just
Mm,
branch off and become clinical director of some company and not do any clinical dentistry at all. So with it, I'd say explore your options by trying to gain work experience and placements in different fields of dentistry, whether that be clinical or non-clinical.
Yeah. Okay.
excellent.
Wise words. Thank you very much. And thank you for the episode once again. You've made the topic of AI dentistry really appealing, I'm sure, to us and to a whole bunch of our listeners. And yeah, it just seems like a very exciting field to be in at the moment. So yeah.
Thank you.
Um, and also make sure, guys, to check out Dr. Denzel over on Instagram. You can find him at Dr. the full word Denzel. And you can keep up to date with his, progress and his journey. And also, thank you guys for listening to the You Know the Drill podcast. Make sure to check this out on our new YouTube channel. It's also called You Know the Drill podcast. So yeah.
Yes, I think we're still getting used to that. And to find out more about dentistry, the application process, and stay up to date with the podcast, make sure you follow us on TikTok and Spotify on at You Know the Drill podcast. And again, make sure you check out our YouTube at You Know the Drill podcast as well. Thanks for listening and watching.
Peace out.